All right, great. Let's get started. Today we are going to be doing case study. So today we are doing case study. Right. So case study on the NCLEX exam definitely include what? 6 items.
No, don't unplug it. Oh. Don't unplug it. I said just pass it to me.
Right. Case study on the NCLEX exam include what? 6 items. Now, you need to know those 6 items so that when you are answering the question, you know what you are doing at that moment. Now, the first one is recognizing clue. That's the first one. Right. This aspect, what you are just doing is what? Assessment. Now, the second part is what we call analysis of what? The clue. Right. This part, you are just trying to create what? A form of understanding of what is going on. Right. Not medical diagnosis, but it can be medical diagnosis as well too, but at least NCLEX can present medical diagnosis, but I think nursing diagnosis. Right. Now, 3 is prioritizing hypothesis. Right. Now, this one is your form of what? Planning. 4 is generating solution. Now, 5 is taking action. The both is your intervention. The last part, which is evaluation, also mean what? Evaluation. Now, this is the 6th item. Right. Recognizing clue, analyzing the clue, prioritizing hypothesis, generating solution, taking action, evaluation. Right. So when you are answering the question, you need to understand item 1 is about recognizing clue. What's the NCLEX wanting me to do? Assess. Now, option 2 is creating analysis. What's the NCLEX wanting me to do? To start figuring out what the likely diagnosis look like.
Hello?
Now, I've seen a lot of students
Hello?
whereby you ask, do you know this medication? They will tell you, yes, they know the medication. Now, all right. Now, prioritizing hypothesis, that is when you are trying to understand risk. Right, you are trying to understand risk. That's what you are trying to do. Right. Or what's going on and trying to create plan. For form of your generating solution. 5, taking action, which is your intervention. And the last part, evaluation. Now, this is your number 1 question on the NCLEX exam. Right, before you attempt the question, 1, you want to understand that you are only doing assessment. So what is the NCLEX wanting you to do here? NCLEX is wanting you to what? Find out what is going on with the patient. We have the nursing note. So all we just need to do is to find out what is going on with the patient. Right. And then NCLEX want us to what? Look for immediate follow-up based on what is going on with the patient. Now, when I'm answering case study question, I like to work alongside with the body system because I can easily link what the patient is experiencing with a particular body system to have an idea of what that patient can be dealing with or what the condition of that patient is all about. Right. That's the reason why I always used to tell students, know your body system. Know your body system is very important because that will help you um, with case study. Now, you don't necessarily need to know the diagnosis. Unlike a lot of students feel like they want to know the what? The diagnosis, right, before they can answer case study. Case study is not about diagnosis. Case study is about understanding how to handle a client as a nurse, right? So the ability to handle your client is in your 8 pie: assessment, diagnosis, planning, intervention, evaluation. Right. You just need to apply to each session what the question is definitely asking you. The biggest problem is a lot of students don't know what is each session is all about. So because they don't know what each session is all about, they tend to not know how to answer the question and they feel they need a diagnosis. Now, this is recognizing clue. All what we are doing is to look for problem and create what? Immediate follow-up according to the examiner question. Your question is saying the nurse has collected data from the client. So these are the data right here. Now, which of the following finding require immediate follow-up? Meaning, out of these 6, we have some findings that require immediate follow-up, but we need to confirm with the nursing note first. Right. So then we can now select our answer. Now, I love to work with body system, as I said. So this is how I approach it. Now, every finding, I'm going to note it, and as well, I'm going to link it to a body system or something like that. Now, client reports pain in left ear. That's a problem. Pain in what? Left ear. The first thing you are doing on your case study, recognizing clue, is to identify the problem. Anything that look like a problem, discomfort, highlight it. Now, for the past 2 days, experiencing pain in the same ear last month. So there's a particular history right here. They experienced that same pain last month, right? But they were able to like tolerate the pain, right? They did self-treat with over-the-counter medication, right? Client is febrile, meaning they have fever. This is a problem with small amount of sediment over the left ear canal. So this is a problem as well too. Now, prescribe azithromycin, right? Now, if they add this prescription, I don't need to see if this patient have infection or to see if the fever is related to maybe because increased temperature can be infection or inflammation, right? So now the NCLEX is saying this patient had this prescribed medication. It means that the doctor knew the patient have what? Infection, and they gave prescribed this medication for them. So I'm thinking about what? Infection to the ear. So right now I have a clear understanding that this patient likely have what? Infection to what? The ear. And as well to remember they have pain. Now, the question is one that's telling me that the note. So they had 500 today and then 250 PU daily for this, right? So that's just medication thing. Now, day 13, right? Another nursing note. Now, client returned to the clinic reporting that left ear pain was reduced after they completed the medication. So that's not a problem, right? They completed the medication or everything reduced. Now, but it reoccurred 3 days ago. Now, everything has been happening. If you notice, they had the pain 2 days ago, right? A month, right? Last month, like let me say last month, they reported again that the pain has reduced, but it recurred again 3 days. So now this is the third time the patient is having that issue, right? So yesterday, client observed drop of blood on the pillow. This is a problem. Report bile colored emesis. Right, this is a problem. Last night after eating dinner. Right. Report having no oral intake today. Client states, I have not had an appetite over a week. Right. So this is a problem. Client is febrile. Again, day 14, they are febrile. Experiencing dizziness, that's a problem. Vertigo, tenderness over the left mastoid process. Right. Now, purulent discharge is a problem observed in the left ear canal. Tympanic membrane is dull and bugging on otoscopy examination. I cannot really remember anything about this. So I'm just going to start that. Now, client report decreased hearing in the left ear. That's a problem. Onset of headache. Right, that is a problem. Now, abdomen soft and aperitive bowel sound. Now, there's difference between hypo, active, and absent. Hypo means we have sound, but they are low sound, unlike when we say hyperactive sound, right? But absent bowel sound is the one that is a red flag. Hypo, at least we still have something, right? So, right. I'm still going to note it though, hypo, but might not be a priority. Now, last bowel movement was yesterday. Brown stool, cyanosis, chest, throat clear without congestion, ECG is normal. So yeah, these are the problem we have. Now, so far so good. Everything this patient is complaining, they are all related to what? The infection of the ear and as well to pain. They had other complaint, which is the vomiting, the dizziness, vertigo, tenderness, all that kind of stuff. Right. So now that I have all this information, I can easily know what is priority. This is my current information because this is previous information. So I'm going to work with current information, which is day 13. Now, patient have vertigo is a problem. Appetite is a problem on the question. Vomiting is a problem on the question. They complain of headache as well too. Is a problem. Bowel sound hypoactive, right, which is on the question. But cardiac rhyme is not a problem because they said it's normal, right? So, but we are trying to deal with what follow up, right? Now, everything right here are issues on the question, but what me I like to do best is I like to select four answers only. If it can be more, I don't know, but four answers. So definitely headache is priority. Onset of anytime you see NCLEX using keyword like onset, sudden, recent, experiencing, um, currently, new, they are priority. So onset definitely for a standing here. Vomiting 100% definitely. Vertigo definitely. Right. So we don't know the reason why this patient is not having appetite issues. Why they're having appetite issue. they there's nothing stating it. So it's something I really want to look out for as well too. So I'm just going to stick with 1, 2, 3, 4, and I'm going to leave 5 out. Why? Because here is saying the abdomen is soft. Abdomen is soft. Um, yeah, pretty much. That's what I'm just saying. I just want to pick 4. So that's it. But for sure, 1, 2, 3, 4 is definitely
Yeah, we move because they have a bowel movement, so bowel sound is fine. So I'll take vertigo, appetite, vomiting, and headache. Yeah, those are the 3 I will pick up.
yeah,
Before.
1, 2, 3, 4. All right. So yes, I like to take note of what is going on, right? Because we are going to use it as well too in question 2. Right. Remember we selected vertigo. A lot of students don't remember what they selected in their first answer. They think every question are uh a different question entirely. No, that's not how case study work. What um you have here in item 1, you will use it for item 2 as well too. So remember your answer and the problem. Vertigo, appetite, vomiting, headache is what you selected. So remember it for the next part of the question. Now, the next part of the question is saying the nurse has reviewed the collected data with the registered nurse. Right. Which of the following complication is the client at risk for experiencing? This is your this is the way NCLEX tests you for your part 2, which is your recognizing clue. Right. Is it that the NCLEX is going to give you different condition and ask you to link the what are they calling it? The sign and symptom to each of the condition, whereby you need to tick which one is appropriate to each of the condition, or the NCLEX will just tell you what is the patient at risk for, right? Any of the two. Now, but now the NCLEX is saying, what is the patient at risk for? Now, what one, you need to understand what risk mean, right? Risk means that if we don't treat this patient condition now, this patient is at risk for so, so, and so. So we need to find solution to this patient situation so that they don't get at risk for so, so, and so. Now, if you remember, we selected what are they calling it? Earlier. No, on the NCLEX exam, you'll be provided marker and a board to write. So me, I would have written those things down. Right. But remember, we selected what? Vomiting. So let me just write it out like this. Vertigo, appetite issues, vomiting, headache. All right. So I'm going to take note of those things and I'm going to now find out because this is what the patient is experiencing. They also have pain, they have infection. Right. So I'm going to like now find out. Now, if you say the patient is going to be at risk for leukopenia, you need to see something in the notes that tell you the patient is at risk for leukopenia. First of all, you need to understand what is leukopenia. That's low um white blood cell. So is anything in this question that is telling you this patient is at risk for leukopenia? Obviously, no. Right. Obviously, no. So definitely I can exit out. Now, the patient, they have what are they calling it? The patient, I'll come back to this. I'm still thinking about this. Now, but definitely vomiting can put the patient at risk for fluid imbalance. So definitely correct. Vertigo can put the patient at risk for injury for fall. Definitely correct. Now, venous thrombosis, that is clotting, right? There's nothing in this question that is telling us the patient is having um that will lead to venous thrombosis, which is clotting. They don't have any condition that will put them at risk for clot.
I
Right.
have a question. I have a question to ask you.
Ask me, please.
What is I always see this, I always see like paralytic ileus. I never understand like what exactly it means.
All right. First of all, what is ileus? That is one. What is paralysis? That is two. So put the two together, you'll be able to identify what it means. What do you think it is based on the name?
Is it like a blockage, like in your intestine? Like you can't like.
All right. One thing I want you to know is that it's a risk for when patient is having no bowel sound for a long period of time, most especially after surgery. Right. Then the paralytic ileus is going to occur. So after surgery, what we do, because this is a complication after surgery, uh, probably maybe abdominal surgery or generally surgery, right? So what we do to avoid this is to tell the patient to ambulate, right? So that the bowel sound can come back and then they avoid this particular complication. Now, paralysis, let me just say maybe paralysis, right? And then ileus, right? That is when the intestine totally stop working. We it happened in two ways. Right? I'm just trying to explain through surgery now. Now, because we do this intentionally to the patient. Unlike this, something is going on with the patient that is making them have hypoactive bowels, and which can lead to that particular condition. But surgery, we give them medication, sedation, right? So bowel sound is gone. We expect bowel sound to be back after surgery, nothing less than 6 hours. But after 6 hours, bowel sound is not back. Now, this patient is at risk for this because obviously the bowel sound is not there. Then we are not trusting the intestine to carry out the activity. So for a long period of time, then it can lead to what? Completely a stoppage of the intestine from working. Right. So um if this definitely occur, then guess what? If you are feeding this particular patient, there's nothing that will push the food out, and then blockage can occur. Right. So that's just what is going on with the condition. So same with this patient, right? What I'm thinking in this particular question is, now they said patient had last bowel movement yesterday, formed brown stool. There's no problem with the stool. Right. They said they have abdomen is soft with hypoactive bowel sound. Yeah. If we don't attend to that, um, maybe later on, patient condition can change and then they might be at risk for this. So I'm going to include this as part of my answer as well too. Any question, please?
Yes, Favour, I have a question. So if it was a hyperactive bowel sound, will not pick paralytic ileus, correct?
Yes, exactly.
So because it is a hypo and we are picking it, so in case they didn't use hypo, they said, okay, bowel sound is absent, we'll still pick paralytic ileus.
Exactly, yes.
Okay.
Yes. Hypoactive can lead to paralysis if you don't find out what is causing that. Because
Okay.
hypo is not good. We need hyper,
Okay.
right? Or bowels and head. Yeah, it can be hyper. There's nothing bad with hyper or bowels and head. Yeah. But hypo, there's a problem. That's why the patient is having hypo. Right. So, yes, that's why. But you understand why venous thrombosis is not the issue, because we are not dealing with cardiovascular problem. Every issue right here is problem with the ear, an infection, pain, abdomen. Apart from that, there's no cardiovascular problem that can cause venous thrombosis. So the patient is not at risk for that. Leukopenia is as well low WBC. There's nothing in this question that is putting our patient for low WBC. They are not on chemotherapy and medication. They are not anything that can cause the WBC to be low or something like that. Nothing like that. So yeah, that's definitely the answers you're looking at. So based on that,
What about, excuse me, what about the antibiotics?
what happened to the medication?
Wouldn't it cause a low white blood count?
Antibiotics don't have anything, don't fight the what are they calling it? Antibiotics fight the infection. It don't fight the immune system.
Okay.
All right, it's the infection that the antibiotics is fighting. Right. The reason why the patient WBC is high initially is because the immune system is trying to create more army, right, or soldiers to fight that infection. Right. We are giving them antibiotics in order to help the immune system as well to fighting the infection. So you fight the infection and then the WBC return back to normal.
I think I left my water.
Right. Any other question, please? All right, let's move on to the third part. So this is prioritizing hypothesis, right? So now the question is asking you that the patient is at highest risk for developing what? So now the NCLEX give you 3 different conditions: meningitis, autosclerosis, Meniere's disease. So based on what the patient is experiencing, you are thinking the patient is at highest risk for developing what? Right, based on what the patient is experiencing. Now, obviously they are talking about purulent discharge, infection, pain, right? So all these things are definitely situation that can be a problem to what? They are not situations, they are situations that are surrounding the year right now that we are seeing on this progress note. Now, but we're thinking about highest risk. Now, for me, basically, the highest risk right here is the fact that um this patient can be at risk for meningitis, right? Autosclerosis, I'm not seeing something like that. Meniere's disease, I'm not seeing something like that as well. Right. But this patient, based on that infection, it can easily travel down to the brain and then what? Cause what? Meningitis. So that is the reason why the highest risk right here is meningitis. Right. Any
Wait, what?
question?
I have a question. So what if the question had asked like, what if it didn't state like the highest risk? It would have been Meniere's disease, or if
Your
like if the client is at risk for developing, would it have been Meniere's disease?
I don't understand your question. Your item 3 is always going to ask you for highest risk.
Oh, it's always gonna ask. Oh, okay, okay,
Yeah.
okay. Okay,
That's why
got
I said earlier on to understand each item. The problem is this: a lot of programs don't know how to write case study because their whole goal then was to rush into the case study so that people can just buy the program based on everybody were looking for how to study NGN question. So a lot of programs were not patient to learn how the NCLEX go about the case study. So they just jump straight into it.
I have a
Right.
question.
Ask me, please.
Um, how come you cannot beat Meniere's disease? How you think it's meningitis? What is the
I was
clue?
gonna ask this.
What is the clue tell you it's meningitis? Because I was gonna go to Meniere's disease.
Yeah, me too, Favour.
Okay. Tell me, why do you want to select Meniere's disease?
Okay.
Because it's
Okay. It says that the client state I have. No. Hold on. Let me see. I'm sorry. I have to.
it states that like vertigo. I know vertigo deals with Meniere's disease, right?
Yeah, vertigo is part of it because vertigo. When you do have vertigo, um, what's really got me is the fact that it says, okay, I have not had an appetite over a week. Client sees febrile and experience dizziness, vertigo, and tenderness over the left mastrode process. Periodon drainings observe the left ear canal. Okay. Tympanic membrane is dual and bulgy on the otoscopy exam, which is exam of the ears. Client report this decreased hearing on the left earring and onset of a headache. To me, that sounds like a Meniere's disease. Those are the clues that giving me the Meniere's disease.
All right. So now the problem is you don't know what risk means. Risk means what we are experiencing right now can cause something else entirely. So NCLEX is not asking you to link this symptom with the condition. NCLEX is just like right now. If a patient is having hypertension, right, one of the sign and symptom of hypertension is what? Headache. Now, but if NCLEX is saying, what can this patient be at risk for? This patient can be at risk for what? Stroke. I don't necessarily need to see the sign and symptom of stroke when they are telling me the presentation of a patient who have hypertension. But I know that the patient with hypertension is going to be at risk for stroke. Based on that is how hypertension can easily lead to stroke due to the nature of the disease. Right. So now what you are doing right now is to link the symptom with the condition instead of thinking about the risk. Everything that is going on right here interpret a lot of things. It interprets otitis media, it interprets Meniere's disease, but NCLEX is not asking you for the interpretation of what the patient is experiencing. The NCLEX is asking you to think about what can happen if we don't treat this patient's condition. Guess
Yeah,
what? What this patient is having right now,
can lead to
right,
something
can
worse.
lead to something. If you are thinking Meniere's disease, this can be Meniere's disease. Remember, we are item 3 of the question. When NCLEX is going to review the diagnosis, NCLEX is going to review the diagnosis in your item 4. Item 4, NCLEX will review the diagnosis. That's when
So
the doctor will give the diagnosis. But right now, we are just trying to think about what the patient is at risk for.
that's
Now,
where the critical thinking comes in.
So now, everything right here can be otitis media. Otitis media also have dizziness or the kind of thing. It's a problem with the ear. Meniere's disease is also a problem with the ear. So why is it Meniere's disease again when we are thinking about risk? If this is a sign of Meniere's disease, then it's no more a risk.
It's the symptom. It's
It's
the
already
diagnosis.
the Meniere's disease.
Yeah.
Right. But we are not thinking about the diagnosis. We are thinking about the risk. What can this patient be at risk for? And
That
NCLEX
makes
has
sense.
given you hints in the nursing notes because the nursing notes mentioned something, infection. So now, based on how the ear is connected to the brain, infection can easily travel
Travels
from the ear to the brain.
to the
Then
brain.
cause
Yeah.
what? Meningitis.
Yeah, makes
The
sense.
patient don't have meningitis now. That is why we are saying they are highest risk for developing what? Meningitis.
Yep, makes sense.
Right. And two, one thing I want you to know is this. Right. I don't just like to when I try to explain, I don't like to go deep. Why? Because I want surface understanding so that you feel like NCLEX is not difficult based on surface understanding. You don't necessarily need to go deep. But if I go deep, right, this Meniere's disease is a chronic condition.
And we're
It's a
looking for an
chronic
acute.
condition. And
We're
if
looking
it's
for
a
an acute.
chronic condition, right, so far so good from my experience, patients will not be getting it 2 days, come back again after 1 month, now repeat itself 3 days. Chronic condition, it is there.
Yeah.
It's not coming and going. So it cannot be Meniere's disease. Because Meniere's disease is a chronic condition, it's there for life.
Wow.
It's not going
Good.
and coming.
Wow.
Otitis media, yes, can be going and coming. So if you're even thinking otitis media, okay, great. But it's not part of the option. Now, sclerosis is even out of the picture. So the next thing you are thinking about is what? Meningitis.
Makes sense. Makes sense.
All right. Any other question, please? Now, this is the other part. Now, okay, see, look at what the NCLEX is saying right here. You can see what the NCLEX is saying. Client is admitted with what? Recurring otitis media. You can see it's not Meniere's disease, because that's chronic. You don't expect chronic to be recurring when it's there. Just like saying diabetes will live today, come back tomorrow, or you will get cure of diabetes today, come back tomorrow. No. Or you will get cure of hypertension today, come back tomorrow. No. They are there for life. Right. So there are a lot of diagnoses. I can think about a lot of things, but basically I'm just focusing on what? Risk. To not complicate it, risk. Right. So now they have given us what the patient is having, right? Based on the progress note, they said 9:30, they got evaluation and treatment, right? Then that's their diagnosis. Now, the history and physical finding and is contributing to the plan of care. Now, which of the following healthcare orders should the nurse anticipate, select, or that apply? Right. But let us see what the history and physical finding is. History and physical finding. All right. Patient neurological status, they are alert, oriented to place time, right? Uncomfortable, and become irritable. Okay. They have that's their condition. Worsening symptom. The vital sign is the respiratory rate is okay, pulse is okay. The lung sound are clear. Patient quit smoking. Right. So to me, this part is pretty much good. This part is pretty much good. Vital sign for cardiovascular, temperature is high. Right. Temperature 100.4 degree Fahrenheit shows infection. So temperature is definitely high. Pulse is high. Blood pressure is good. S1, S2, good. In as much we are not hearing S3. S3 is the red flag. Pulse 2+ is good. Experiencing vertigo and headache, this is the only concern right there. Okay. Now, weight loss 12 lb in 2 weeks. Reported experiencing anorexia for the past week. Nausea, vomiting once yesterday. Okay. Generalized weakness, voided 450 of amber colored urine. Right. They had allergy reaction to penicillin. Right. Another medication that a patient can have allergy reaction to when they have penicillin is amoxicillin and cephalosporin, and also this medication, cefotaxime. All right. Married, live with spouse and children. State the last time I was in the hospital was when 11-year-old child died 2 years ago. Reported that the older child was 3, hit by a motor vehicle and died. Said that it's sad, but my faith got me through. Now, it was sad, but my faith got me through. It means that they have recovered from the particular issue. So the psychosocial part is not an issue. Right. Now, there are two options right there that they will never be the answer in this question. One, the fact that the NCLEX is putting this, and the fact that the NCLEX is putting this patient is not grieving because they said their faith got them through, so they are totally fine out. And as well too, this patient, right, they voided 450, so they don't need any issue with indwelling catheter because they are not struggling to pass urine. Right. As well too, we are dealing with otitis media. Otitis media is not airborne, it's not droplet, it's not contact, so definitely this is going to be out. Right. So With that being said, we are looking at number 1, 4, and 5. Now, definitely number 6 is correct because we are doing CT scan of the head and ear for sure. Culture to test for ear drainage for sure. Right, we are doing that. And we also want to make sure that there's no infection because remember previously before we were thinking about risk for meningitis. So we want to be sure that infection has not gotten to what that is transferring to the brain via the spinal fluid. So definitely want to do lumbar puncture. Any question, please? Any question, please?
So why are we anticipating a lumbar puncture when it's an infection of the ear or the fluid is coming out from the ear?
Okay, it all comes from how do you know if a patient have meningitis? Remember we selected what are they calling it? Previously, the risk right here. We selected meningitis. Right. So now the NCLEX is not telling you which of the following healthcare orders should the nurse anticipate. We've confirmed that this patient have otitis media, infection of the ear. Now, the patient is at risk for meningitis. That's why I say every of the question build upon themselves. Now, I know that this patient is at risk for meningitis. So it's expected that the doctor want to confirm, to rule out that this patient don't have meningitis. So how would the doctor confirm that? That's through lumbar puncture. The doctor is just going to get the fluid and we test it. Right, from the spine, because that is how the infection can travel down to the brain. If I'm wrong, let me know.
Okay, thank you.
All right. Any question? Any other question?
No question.
All right. So, every time you're answering your case study, always identify what you are doing, right? Based on the item, and as well too, remember to always refer back to previous information because it's one question splitted into 6 parts. So it's very important. Right. So that is that for that. So that's the correct answer. 1, 4, and then 6. Right. I always used to tell students, if you are selecting answer on the NCLEX exam, always look for the wrong answer first. The wrong answer is always known than the correct answer. The moment you can do your elimination very well, trust me, you are going to get the correct answer. So the fifth part of your question is what we call taking action. Now, so we're about to take action. So the NCLEX is saying we have nursing notes 10, 10, which is this. We have that already, 16 o'clock. So patient is going for a surgical procedure. They are scheduled for a surgical procedure. And as well to 16 o'clock, patient return right from surgery. There was no problem during surgery, no complication. Patient is definitely stable. Right. So diagnostic result from 11, let us see what's there. Now, you can see what I was saying. Doctor tested it and then it's negative for infection. It means that this patient, fortunately for the patient don't have what? Meningitis. Now, CT scan of the head and ear, negative as well too. So the only thing the patient is having right now is left mastoid bone. So now, why is it that a lot of students will want to look for the diagnosis to the question or try to study thousands of case study questions because they want to be well prepared with diagnosis? To me, that is a wrong way to study because at the end of the day, It's not about the diagnosis. You are not the doctor. The doctor is going to provide the diagnosis. You just want to know how to think like a nurse. Go through the case study. It's clear. You want to understand how to answer recognizing clue question, how to analyze it, how to prioritize hypothesis, generate solution, taking action. The answers are always in the question. You just need to think about it and find out what is going on. Right. Find out what is going on. Because at the end of the day, the doctor will give you the diagnosis now. Doctor is saying the patient have what? Problem with their myxoid bone. So all this while we're thinking about otitis media, we're thinking about Meniere's disease, we're thinking about meningitis. At the end of the day, right, those are things that surround the patient, but there's just one diagnosis. So you don't want to get confused with diagnosis. You just want to follow the question. It will lead you through to the correct answer. Right. So now we know what's going on, and then we can be able to answer the question. Now, so let's see what the laboratory result is saying. Now, laboratory result is saying negative for cultural sports. So now the NCLEX is asking us to select potential intervention, what is indicated and what not indicated. Right. Now the question is saying keep the client supine for 24 hours. Guess what? This patient just had what? Lumbar puncture. Now, one big risk for lumbar puncture is severe headache. And how do you fix that? By placing the patient supine. So is that going to be indicated? Obviously, yes. Why? Because of the lumbar puncture. If you anytime you see lumbar puncture, we put patient supine. Right. Now, access bleeding from the left ear. Previously, before, they said patient was bleeding, right? The pillow, right? So it's necessary for me to what? Assess. So definitely that is indicated. Now, administer antiemetic to prevent vomiting. Yes, because patient was what? Vomiting before. Right. So we need to give medication to fix that. Right. Now reinforce the importance of coughing to clear airway. Let me look at this. Reinforce the importance of coughing to clear airway. This will not be indicated. Why? Because of the diagnosis. Remember, they have inflammation of the left myxoid. You know.
I have a question.
Ask me, please.
Okay, you said reinforcement. When would coughing be a reinforcement? Because sometimes I think like, like with the spirometer, if you can't come out of a procedure or things of that sort.
Coughing, we do coughing for various reasons. Deep breathing and coughing is for different reasons. Now, read what this one is telling you, why we are doing this. We are using it to clear airway, right? Which is one. That's one. Two, we're also trying to see, is there anything in that we have, right? Based on everything the NCLEX asks us to check, because the NCLEX asks us to check through all this that can make this not an indication. Right. The patient have inflammation of the left myxoid bone. Now, guess what? If they cough, they just return from surgery. If they cough, there will be a problem. Serious pain. So that will not be indicated for them to do.
Okay, thank you.
So I have a
All right.
question. Would the
Ask me.
coughing like raise like their intracranial pressure?
No, coughing is a good thing.
Okay.
After surgery, it's a good thing. The only thing right here is the fact that they have inflammation of the left myxoid bone. That's the only thing right there that is making me feel we should not reinforce the importance of coughing to clear the airway as at now, because they just returned from surgery. It can cause discomfort, right, to what is going on.
May I say something? I believe when whoever was talking earlier asking about the coughing, um, when they have an ICP, you don't want them to cough that much because of the fluid they have. But like you said, coughing is very important. It's very important for the lungs so that you don't have so they can have enough airway into the lungs and they don't develop pneumonia.
Yes, coughing is very important, but the
Thank you
reason why
so
NCLEX
much.
the reason why NCLEX is having indicated and not indicated is for you to spot out if there's any contraindication to doing that activity. Right, there's no contraindication to putting the patient supine. Instead, we need to put the patient supine because of the procedure, the lumbar puncture. If not, there will be serious problem. Let me see all this. Any other question, please? Any other question, please?
No.
No.
Okay. All right. So now, the last one, which is evaluation. Right. So progress notes, 14 o'clock discharge, clients to home with 16 o'clock to 14 o'clock day. 16 o'clock to 14 o'clock. I might be wrong about this. What are they calling it? I might be wrong about this particular answer. This particular one right here. I might be wrong, not because of we don't put patients supine, but based on the hours.
Because of the 24 hours.
Yeah, because of the 24 hours. So that is that for that. But even if I'm wrong, I'm definitely still going to get maybe like 2/3. Yeah, but it's based on the hours because the nursing note is not saying we are keeping them for long because patient is stable and then they have all of a sudden returned patient. So patient barely spent 24 hours. Right. So based on that, I feel NCLEX has a special reason for that. I don't really know. I know. Let me look that up. So we put patient supine. So very, very important. Supine after lumbar puncture, most especially when you give epidural for pregnant lady after lumbar puncture. I want to see the hours or something like that. Line supine meaning flat, recommended after lumbar puncture. But I don't know why NCLEX is saying 14 o'clock patient returned home. Okay. 6 to 8 hours. Right. So 6 to 8 hours, so not 24 hours. So that's the reason why it's wrong. All right. Now, the last part is what we call evaluation. Right. So patient has been discharged home, right, with instruction. So now I should avoid blowing my nose. That is one client statement because we are trying to they say for each statement made by the client, click to specify whether the statement indicates an understanding or no understanding of discharge teaching provided. Now, I should avoid blowing my nose. Understanding or no understanding. I should avoid blowing my nose. Right. Now, the reason why we are saying understanding is obviously because of the surgical procedure. Most of you don't know, or maybe you know, NCLEX has left the medical condition that is wrong with the patient initially, and the second part of the question started dealing with what? The surgical aspect. I don't know if you notice. We are not even talking about the otitis media again. Now we are not even focusing more of what? The surgical aspect. Right, so I should avoid blowing my nose is due to that surgery. match to it. Same way we don't want them to cough. Right. So definitely that's the answer. Understanding. Now, I will experience some permanent hearing loss. That is no understanding. There's no permanent hearing loss. Right. Now, I should check with my physician before I travel. Anytime the NCLEX tell you report to the physician, you are answering what? A select or apply question, or you are answering case study question, or you are answering pharmacology question. I can 100% guarantee you that anytime the question, whether it's a select or apply, charts, bow tie, case study, pharmacology, and the NCLEX is telling you anything about physician, select the answer is always correct. Right. So understanding this, I will stop taking anti-effective as soon as I no longer have ear pain. That is wrong teaching. Right. We don't tell patients to stop taking their medication even if they don't have the pain. They must continuously use the medication for the duration of the prescription. They should not stop. Right, despite the fact they don't have the pain. So no understanding. I should not shampoo my hair until my physician instructs me to. Physician is involved, trust me, is very correct. Right. That is how the NCLEX work, right? Yeah. So that is the answer. Any question, please? Any question?
Will this be the only case study you're going over tonight?
You want me to go over another one?
I mean, if you have the time, I know it's pretty late.
All right. Let me check for. So I'm done with this one now. Let me check the other case study. Let me pull up the case study. The truth is a lot of program don't know how to write case study. That's the reason why when you go on the NCLEX exam, you feel lost or they don't know how to, most especially, right? You buy a program, you have case study, you figure out one site yourself without not learning the process because it's a process, it's a system, right? It all starts from recognizing clue down to evaluation. And see, as I was working with every information in the question in order to get to the answer without not overthinking anything. Right. So if you want to know how NCLEX give you case study on the exam, go on the NCLEX website. This is the NCLEX writer right here, the NCSBN, and they have given you sample pack of how case study look on the exam. Now, that way, you are well prepared to answer what? The question. Right. So that is how you can easily get prepared. Right. You don't need 1,000 case study. You just know how to think. You just want to know how to think like a nurse. You need to understand each part. The first part, recognizing clue, you want to find out what is the problem. Right. That's the first thing you are trying to do. You want to know what is the problem. That is the same way you are going to answer any case study on the NCLEX exam by finding out what is the problem. Right. NCLEX is telling you right here to what? Select 4 client findings that require immediate follow-up. Right. All you just need to do is to find out the problem and then decide which require what? Immediate follow-up. So now the client was brought to the emergency department by the client adult side due to increased shortness of breath. Increased shortness of breath is a problem. I'm taking note of that. Now, this morning, the adult child reports that the client has what? Running fever. So now we have what? Shortness of breath, fever. they are coughing what? Green mucus. That also clarify that this patient is what? Having what? Infection. So I can just put what? Infection right there. Now, because green mucus is infection. Now, let me tell you something, because I like to teach when I have the opportunity to. Now, mucus, your mucus, right, should be white. Now, if the NCLEX is saying something like pink, yellow, green, what other color? Pink, yellow, green. All right. Or red, yes. Red, pink, yellow, green. Now, red, obviously, we are thinking, oh, this patient maybe have TB or inflammation. You can see red with COPD, inflammation. They will say blood, think, mucus. Right. Green, indication for infection. Yellow, indication for infection. Pink as well to indication for maybe bleeding or something like that. Red as well to bleeding. Right. Same as your drainage. Right. Drainage can be wound drainage. It can be anything. Right. Any form of drainage. Right. And your drainage is showing active bright red. NCLEX is saying bright red. This is red flag. There's a problem. Right. Your drainage bright red is a problem. So know that your drainage. So take note of all these things. Right. You don't need to know what's going on that is causing the patient mucus to be pink. The moment you see pink on the NCLEX exam, select it. NCLEX is a safety test because it shows that there's a problem. You only know your mucus should be white. Right. Except if there's other thing that is a priority more than this. But there will not be anything that will be priority more than a pink mucus. There will not be anything that will be priority more than red mucus. There can be something that can be priority over yellow and green. Right. But you just need to figure your answer key out. Pink, bleeding or blood in the lungs or fluid in the lungs. Red, bleeding as well too. Right. We take high priority of this. Right. So soreness is a sign of infection. And the infection that causes soreness is influenza. Right. Soreness is due to virus. We have 3 types of infection. We have bacteria, we have fungi, and then we have virus. Bacteria can happen inside the body and our skin. Right. Fungi outside, only the skin. Virus inside. Right. So that in case NCLEX is testing you on skin problem, right, you definitely know. Fungi definitely can be skin problem. Virus, no. Bacteria, yes, because it's either in or out. So these are the only common skin problem on the NCLEX exam. Take note. Now, NCLEX is very brilliant because allergy also show up on the skin. So NCLEX might put a certain image and ask you to differentiate between bacteria, fungi, and what? Allergy. Right. NCLEX can do that. So you need to know the presentation for bacteria, fungi, and allergy. Allergy on the skin is like map. Allergy on the skin is like map. Fungi is like ringworm. It's round like this. It's round like this. Then there's scaling or flaky area around it, right? This area is red. All of them are all red. Bacteria, fungi, red, and allergy red. But allergy is like map. It's just like this on the skin. And then bacteria has like vesicles. So that's how you know. Let me see some images online.
I have a question, Favor. You said allergy is like a mop. I don't know what
Yeah,
you're saying.
it's like a map. I will show you.
MAP,
So
like a map.
yes, map, MAP. Let us see bacteria. Let me see bacteria infection. Let me put, okay, it seems there's one here. All right, you can, okay, look at the vesicles. You can see all these round, all these things right here. Right, this is how you know bacteria infection. That's how you know bacteria infection. Let me see another image.
And those are vesicles?
Yes. Right, look at it again right here. You can see right here. That's how you know bacteria. Now, let us see fungi. Let us see fungi. All this is I'm sharing. I've seen it on the NCLEX exam. That's the reason why I'm just talking about it. Just in case you see it. You can see how this is round. It has something. There's something again. They are all round. Look at how they look like. You see all of them. They are similar. See this one. You can see them. Right, see. Right. So that is how your fungi look like. Right. Let us see allergy. Allergy. Let's see allergy. Okay, let us see this. I'm the one that called it map because that's how I identify it. I don't know if anybody call it map, but this is what I call map. Look like a location. You understand? See. Look at all like right. To me, look like map. Let me see another image. Right, and the surface can be swollen because yes, you know, that is allergy. Allergy is swollen. Look at right here. Right. So yes, that is it. You need to be able to differentiate because the NCLEX will just can give you a certain image and just tell you, okay, what is this? Right, and what medication should you give? So you need to know your antifungal medication, bacteria, and as well to allergy. We have mild allergy, we have severe allergy. Mild allergy, you only have something like hives, inching, rashes. But severe, this you just give your antihistamine, right? But severe shortness of breath, dyspnea, angioedema, lip swelling, anyone you want to call it, hypotension, low oxygen. This severe, you give what? Epinephrine immediately. Anytime a patient is experiencing allergy, you want to do what? Stop what is causing the allergy. Next thing you want to do is to assess the patient and report the situation to the doctor. And last thing is to document. So that's what you need to know for allergy. Right. Anytime you see allergy on your NCLEX question, select it. And it's NCLEX, the exam is the safety exam. If you see any answer key that is saying allergy or a particular question that is asking about allergy, trust me, the answer is correct. Just select it. Right, because that is how the NCLEX work based on safety.
Favour,
Allergy is a big safety.
Favour, for mild, you said it was like hives, rashes, and what else? There was a third one.
Inching.
Oh, itching. Okay.
Yeah. Yes. Right. I'm just taking time to explain a lot of things because they're on the NCLEX exam 100%. So allergy, right, is related to three things on the NCLEX exam: medication, what else? Procedure, and medication procedure. Why am I forgetting the third one? Medication procedure. I'm not remembering the medication procedure. Okay, I remember now. Food. Right, medication procedure, food, antibiotics. Sorry, medication, antibiotics, NSAID. Remember, NCLEX gave a particular medication, last case study we're doing. Now, that particular medication, they call it penicillin. Now, patient that is using amoxicillin, NCLEX can say which of the a patient had recent allergy to penicillin, which of the following doctor's order should you question or clarify anything? Right, definitely. Patient had penicillin, and then doctor is still prescribing amoxicillin. We need to uh, clarify that because they have the same thing and can cause allergy or other medication like cephalosporin as well too. They are all having the same thing. They can cause allergy. NSAIDs such as aspirin and ibuprofen. Right. Procedures such as your CT scan, surgery. Right. We need to watch out for allergy related to contrast, dye, iodine. Very important. Surgery, latex products, right? Your gloves, plaster, IV line, right? So that's surgery. Food, shrimp, shell, fish. There's one, but I don't know if it's important, but you can include it. Vaccine, allergy to vaccine. Right.
What is that V word you saying? Vax? I don't even know what that is.
Vaccine.
Can you spell that out? I'm so sorry. I'm
A
just
vaccine?
Oh, a
Yes.
vaccine. Okay, got it. Thank you.
All right. So well, from my experience, right? As a nurse, I've seen patients allergic to allergy medication. So I don't know if NCLEX is going to test that. So as part of medication, but I know what is on the NCLEX exam, which is not changing, is antibiotics and then NSAID. Right. So yeah, that's pretty much what is surrounding. So NCLEX now frame the question around this. Now NCLEX might tell you, oh, a patient is scheduled for a particular procedure. Maybe it might be grafts, maybe an issue with the heart, and then want to like send something through the blood vessel, right? And then we are thinking about it, and we are trying to do kind of finding, and we need to put contrast dye in that procedure. One of the answer key might be related to either kidney, where the NCLEX will say access for the patient BUN and creatinine, or one of the option will include access for allergy. Those answers are always correct, right? 100%. Or asking the patient if the patient is having any allergy. Those answers are correct. Those are the answers related. Any answer related to allergy on the NCLEX exam is correct. That's one thing you want to know. Right. But remember, soreness is for virus, not for bacteria. Soreness is for virus. Right. Because the NCLEX is saying soreness throughout the body. Bacteria is localized. Now, if the bacteria is an infection of the lungs, you will not see it troubling the cardiovascular. No, it is going to stay in the lungs. But if it is virus don't like to stay in one place. It affects the lungs. Every other body organ is in trouble. That's why this soreness occur. So yes. Now, that's soreness. Patient is hospitalized for atrial 56 days ago. That's their history. Right. They also have another history of what hypertension. Temperature is definitely high. Pulse is normal. Respiratory rate is high. Blood pressure is high. Right. We know why blood pressure is high. Obviously, patient have hypertension. So for me, that will not be a problem because I already have history right there. So I can easily believe that's what is causing that. Now, the pulse oximetry is low. Now, there's one thing for the oxygen to be low. And there's one thing for this oxygen to be low when they are what? On oxygen therapy. It's more of a bigger problem. You are on oxygen therapy and your oxygen is low. So it's a concern, right? Now, on assessment, the client breathing appear was slightly labeled as a problem, crackles, right? Skin is cool to touch and pale. Pale is a problem. It shows that maybe patient is losing blood or something. Right. Now, 3 plus is bad because your pulse should be 2 plus, not 3 plus. And funny enough, it's irregular. Your pulse should be what? Regular. Capillary fill, 3 seconds. Capillary fill should be 2 seconds. 3 seconds is slightly elevated. Now, sometimes it seems like my parent is confused. Peripheral venous access device is in the right form. Okay. Now, for client findings. You don't want to think about vital sign. If you are telling me you are thinking about if vital sign is a problem, then I don't know what to say. Vital sign is a physiological adaptation of the patient. It's always important. Anytime you see vital sign in any questions, always select it. It's important. That's the most easiest answer you can get on the NCLEX exam. So yes, definitely. Right. Now, patient has been having a lot of lung issue. The whole nursing note is all about the lung problem. So definitely, yes. Now, um, capillary fill is 3 seconds, right, instead of 2 seconds. And capillary fill equal what? Perfusion. NCLEX is very big on perfusion. So because if there's no sufficient perfusion, patients can have problems. So NCLEX is very big on that. Anytime you have capillary fill problem, please select it on the NCLEX exam. Right, it's a very big thing. Client orientation. Client is oriented to what? Person, place, time. So client is doing great. Now, radial pulse characteristics, definitely the pulse is bad. 3 plus irregular for sure. So your answer here is going to be 1, 2, 3, and 5. Any question, please? All right. So now I have everything that is going on, the vital sign, lungs, capillary fill, radial pulse. So I'm going to take that information to the next part of the question. And this is the next part of the question. Now, a lot of students don't understand this part of the question. That's why they get lost when they see this particular part of the question. Now, let me explain. Pay attention, listen to me. Now, all these conditions you have right here, it's not that the NCLEX is trying to use those conditions to punish you. What the NCLEX is saying is that from this nursing note that we have right here, we are suspecting these 3 conditions based on what this patient is presenting. We are suspecting those 3 conditions. Based on some information in this nursing note, the nurse is thinking maybe this patient have pneumonia. Based on some certain information in that nursing note, the nurse is thinking maybe this patient have UTI. The nurse is just randomly thinking, right? The nurse is also thinking maybe the patient have influenza. Remember we talk about soreness. So soreness is related to virus. So the nurse has done an assessment. She knows that, okay, this patient is having lungs or respiratory problem. So she's thinking an infection, right? So with her smartness, she's saying maybe this patient have what? Pneumonia or influenza. Now she's also thinking maybe the patient have UTI because of what? Infection as well too. Right. So now what the NCLEX is now asking you to do is to confirm with the nurse if truly the patient is having all these things related to what? This finding. You are just doing confirmation. That is what you are doing. But a lot of students, they will start thinking about it. Oh, how will I fix the old findings and all that kind of stuff? Maybe I need to know about the condition, but trust me, you don't necessarily need to know. Just understand the nursing note and you'll be able to apply because your answer is already in the question. Now, fever. What is fever? Fever is what? Infection. We confirm that patient have what? Infection. Right. So now I'm asking myself one question. Is all this what? Infection? Obviously, yes, everything are infection. So everything is going to show up what? As fever. Fine. Confusion on the other hand. Now, I don't know what we learn in nursing school. I don't know. But me, what I know, right, in what they call it, about infection is that infection can cause confusion. That's what I know. Right. Regardless of the age, because I used to hear a lot of students say, oh, older adults, yes, they are at risk for confusion. Even a little child can have confusion due to infection. Right. So the question said that the patient is confused. Right. There's somewhere in the particular, okay, yes, right here. Confused. Right. So based on the patient report, the nurse is thinking that. And the only reason why the patient can be confused is infection. Right, it's infection that causes confusion. So for me, I'm definitely going to highlight everything right here. Right, infection. It's not based on the condition because I'm not using the condition to answer the question. I'm using what can cause confusion to answer the question because it's not the condition that caused the infection. The confusion is the infection that caused the confusion. If a patient have what septic shock, that cause confusion as well too. Right, and any age can have septic shock. All right, so that's my thinking. Now, everything to me align. Now, body soreness, I definitely know body soreness is related to bacteria, virus, and this is bacteria, this is bacteria, this is virus. Now, cough and sputum is related to respiratory issue. This is a respiratory issue. This is a urinary issue. This is a respiratory issue. So this and this is out. Shortness of breath as well is related to respiratory issue. So this is a respiratory issue. This is a respiratory issue. This is a urinary issue. So this and this is out. Smart. And that is it. Without not having to think about, oh, what is pneumonia? What will pneumonia show? Waste of time. Right. Even if I am going to be wrong on this particular question, probably 1 or 2, and I'm still going to be above the passing standard. The whole goal of answering case studies is not to be perfect. Even the NCLEX writer made mention of it. We are not paying you to write. We just want to see that you can organize. That is all. But because of a lot of students, they are not aware about this. They tend to overthink the question and they get lost. Right. So, next part is the risk. Right. Remember, somebody was asking, what of you the question did not ask for highest risk? Your question 3 will always be asking you for highest risk. So that's what you need to know. Now, based on what this patient is experiencing right here, we are not thinking, what can this patient be at risk for if we don't treat the condition? So far, so good. What the patient is experiencing here is related to respiratory problem. That's what the patient is experiencing. Right. So based on this patient is experiencing respiratory problem, what is this patient at risk for? That is what the NCLEX is asking. Right. Based on what they are experiencing. Now, another thing the patient is experiencing as well is what? Cardiovascular problem. But NCLEX wants you to prioritize acute over what? Chronic. The cardiovascular problem the patient is experiencing is related to their history. So the history is not important because that is what they have. That is not what we are dealing with. They did not present with that to the unit. Right. What they presented with is the respiratory issue. So we are focusing on the respiratory issue. So leave the chronic ones, the chronic issue. Now, the chronic issue. Now, a lot of students don't know what is chronic and acute most of the time. They feel is the condition that shows maybe either the patient is having chronic issue or acute issue. Right. A patient that have stroke. Stroke is what? A chronic problem. But when they tell you they have new slurred speech, this become what? An acute problem there because we need to attend to this. This is a condition that is chronic, but the symptom of what they're experiencing is what we are trying to fix. So this is an acute issue that we need to solve. Right. So that's the reason why NCLEX don't want you to prioritize using the diagnosis, they want you to prioritize using what the patient is experiencing. Because if you use the diagnosis, NCLEX can tell you a patient who have COPD, right, and they have 81 oxygen. And if you say this is chronic, you will exit out, not knowing they have an acute situation that is telling you 81. And their normal oxygen should be what? 88 to 92%. Then it become a problem. So never on the NCLEX exam, I repeat, never on the NCLEX exam use what? The condition to prioritize. Use the what the patient is experiencing to prioritize. So this chronic history, right, and what they are experiencing is not a priority to me. I'm dealing with the acute presentation, what they presented. Right. So based on that, that's why I'm on respiratory. Now, respiratory is the main thing the patient presented with, and that's what I'm thinking about. So based on the respiratory issue this patient is having, what is this patient at risk for? Right. A respiratory issue cannot cause stroke. It's a cardiovascular problem that can cause stroke, but we are focusing on respiratory issue, so stroke will be out. Now, respiratory issue can put the patient at risk for hypoxia. So this respiratory issue cannot cause this arrhythmia. It's a problem with cardiovascular that can cause that. So this out. Respiratory issue cannot cause pulmonary embolism. It's a cardiovascular problem that can cause that. So this out. So you're left with this hypoxia. So that is definitely your answer. Now, for people that want to go deep down, right? When the NCLEX is asking you for risk, this is stroke. What can put the patient at risk for stroke? Right. Maybe patient is already showing sign of drooling, weakness, right, slow speech. There's nothing like that in this question. So how is this patient, or they are saying maybe patient is having cardiovascular issue that can cause stroke or something like that. Right. Now, the atrial fib of the thing can cause stroke. It can put the patient at risk for stroke. But that thing that I said earlier on, the fact that we're dealing with the acute situation and not the chronic situation, most especially not the history. Right, we deal with the presentation of the patient. What did they present with? That's the main problem that we are focusing on. And that is what we use for our risk. Right, because you can be lost. That's why I'm explaining all these things that nobody explained to you. Right. So that you don't get lost. History is the last thing I think of when I'm answering my case study question. Except if it is important. That's the last thing. Sometimes NCLEX put history so that you don't think about some certain vital sign. Like in this question right now, NCLEX added this history so that you know that is the reason why this patient is having this post issue, and as well, so that is the reason why their blood pressure is high. So it's really a thing with atrial fib and hypertension. So not really important. Right. So we can move on. Respiratory is what we are thinking about, and then can cause stroke, definitely hypoxia, correct. This arrhythmia, no. Pulmonary embolism, patient must show sign of DVT, and there's nothing saying sign of DVT right there. Any question? So we are done with the number 3, which is prioritizing hypothesis. So we are going to generating solution. Now, nursing note from 12, right here. Call to bedside by the adult child who states that the client is not acting right. On assessment, client is difficult to arouse, pale, diaphoretic, pulse is high, respiratory rate is high, blood pressure is low, oxygen is low. So now, there was a particular student who I coached in to take the NCLEX exam. Right, she failed her initial exam before she passed the new one she did with me. Now, she said something which obviously I know, and she's saying that, yeah, true. She really follow up with case study. Now, because she was saying there's somehow that if you answer the question previously before and you move on to the next question, if you got the answer wrong before, you can easily know from the next question that you got it wrong. That is 100% true. Right? If you get a particular question wrong, maybe the next case study can easily reveal to you that, oh, you selected the wrong answer. Like now, if you have selected answer related to stroke, guess what? The 12 o'clock nursing note is not talking about stroke. If you select answer related to dysarrhythmia, your 12 o'clock note is not talking about dysarrhythmia. If you select answer related to hypoxia, obviously the patient's oxygen is 91. So it's low, despite the fact they are on what? Oxygen therapy. Now, if you select answer related to pulmonary embolism, there's nothing talking about pulmonary embolism as well. Right. So, if you selected hypoxia, you're 100% correct. Now, yeah, thinking about the intervention. Intervention, also the same way we answer intervention, you just need to ask yourself, why are we doing this? Defibrillation. Why do we do defibrillation? Patient is not having dysarrhythmia, patient is not having no pulse, patient is definitely having pulse, because we do defib for a patient that have no pulse, but this patient is having 112. So why am I going to do that? So not indicated. Now I Fowler, definitely patient is having what? Low oxygen. So that's more reason why I want to do that. Now, request an order to increase oxygen flow rate. Definitely patient have been on oxygen therapy since 10. By 12, the oxygen still went down. So obviously we want to increase the flow rate, right? Now there's another thing you need to know. We want to make sure that this patient is not having COPD, right? Because COPD must be having 2 to 3 liters of oxygen. So you need to watch out. It's not because, oh, the oxygen is low, we want to increase it that fast. You need to find out if the patient is not having COPD, because with COPD, we don't increase oxygen flow rate. Right. So patient is not having COPD, so we are good. Now, request an order to insert an additional peripheral VAD. Right. To me, for this particular answer, right, request an order. They already have what we have here, PVA. Right. So why do I request another order for PVA? I don't see a reason why. In as much the previous one, the NCLEX is not saying anything is wrong with it. We only request for another order if the previous one there's a problem. So not indicated. Now I want to say another mistake a lot of students do. Now, when you are answering your question, pay attention to the recent nursing note before the old one. It's only if you are not seeing the information in the old one, that is when you now go and look at the new one. That is when you now look at the old one. Now, I've seen this, right, when coaching a lot of students. Now, guess what? The new vital sign is saying blood pressure is 90/60. Now, the previous one is saying blood pressure is 152/86. Right. And a particular student said not indicated to this. Do you know the reason why? Because she said blood pressure is high. So why did they need fluid? And I'm like, what happened to your new nursing note? She said, she felt like they are the same thing. How are they the same thing? They are not the same thing. This is the new one. Right. That's why I always used to scream all the whole time. Understand vital sign and collect assessment, 8 to 2 assessment. Because if you don't know 8 to 2 assessment, the nursing note is going to look surprising to you. Right. The main reason why a lot of students don't like to read nursing note is because they don't understand it. That is just the big truth. Because it's very interesting to read when you understand it. But people why don't, oh, it's a long thing, I don't like to. All right. So indicated, because obviously the blood pressure is low. Right. And I'm able to answer this question because I understand the intervention. Not that I understand what is going on with this patient. I understand the intervention. That is how NCLEX write the intervention. So if a student is telling me that, oh, I need to know the condition before I answer intervention, most of the time I don't just know what to say. Right. Because you are not thinking like the NCLEX or the NCLEX writer. The NCLEX writer will not make intervention complicated. Every intervention you are doing is always related to something on the nursing notes. NCLEX made the case study like that in a way that even if you don't really know anything, you cannot still fail it. But because we think about extra information, we try to bring a lot of information to the question. That's why case study is difficult. Case study is never difficult. I prefer to have 85 question case study and I will pass. So a case study is not difficult. You just need to understand each part, recognizing clue. Right? Because guess what? This is like a cheat for me. In as much as I can know what is in the nursing notes, I know the answer. I don't necessarily need to score everything. At least I can do great because this is just like an expo to me. I just look at it. DFib. What is DFib used for? I don't need to find out what is the patient experiencing that I want to do DFib because that is how a lot of nursing students think. Me, I ask myself, what do we use DFib for? DFib is for patients that don't have pulse. So I ask myself, is my patient having pulse? Yes, they have pulse. So why should I do that? No. What do we use semi-fowler for? Semi-fowler for feeding, for oxygen, for patients that have hypertension. We use semi-fowler. Patient have hypertension, patient is not feeding in this question, and patient have low oxygen. So there are a lot of reasons why we do what? High fowler. So indicated. Why do we increase oxygen? We increase oxygen if the patient is having low oxygen despite the fact that we started oxygen therapy. That is the reason why. So I ask myself, is the patient oxygen low? Obviously, it dropped from 94 to 91. So yes, that's a good reason why I want to increase it, even without knowing the patient's condition, because as at this point, I don't even know what the patient is experiencing. The only thing I know is the patient is having respiratory issue. But a lot of students will start saying, oh, I want to know what the patient is. It look like the patient is having so and so. NCLEX is not asking you to diagnose. Stop giving yourself problem. NCLEX is not difficult. It's you that make the exam difficult because you are not following nursing principle. You are following question. There's difference between thinking like a nurse and answering question like a nursing student. When you try to answer question, right, and there's no clear direction, you guess on it. You try to learn information that you don't even understand. But if you understand nursing principle, then you will be able to think about it and say, okay, this is why this social thing is occurring. This is why the doctor is doing this and that. And you are able to answer the question. Now this, while we are requesting additional peripheral venous access device, when patient have one, and there's no problem because we only request if the previous one is 40 and nothing is wrong with it. So why do we request? All right, so why do we request? So definitely no, but this definitely because the blood pressure is low. There's two reasons why we can give IV fluid. If the patient is dehydrated or blood pressure is low. And guess what? Patient is what? Blood pressure is low. No dehydration issue, but blood pressure is low. So yeah. Right. So that's how I think about it. No complicated thinking, no prior knowledge, just nursing principle. Now, NCLEX is saying that the nurse is reviewing what orders from 12, 15, and this is the order right here. Right. So consider parity. Now, what the NCLEX is saying right here is that because I've explained parity to a lot of students. Right. Parity means that you have more than two answers. So NCLEX is trying to say there's possibility we are going to do everything here, but tell us the parity that we are going to do right now. So now parity, what are we thinking about? We need to firstly know what the patient is having. Guess what? The patient is still having what? Their respiratory problem because we have not fixed that as at yet. That is one. The infection, that is two. Their oxygen that is low. The blood pressure that is low. So these are things that is still the problem of the patient. So now, insert indwelling catheter. I'm not seeing a reason why I should insert indwelling catheter right now. So, out. Nothing like that is stating it. Now, vancomycin, guess what? The patient still have the infection. We've not fixed that. So, yes, this is priority. Now, CT scan of the chest. I'm not seeing any problem with the patient chest. They are not having cardiovascular issue. And also, they are not having a certain respiratory issue that we need to start saying what is going on or something like that. The only thing is They have respiratory, no obstruction, no any kind of thing like that. So why am I doing that now? Out. Patient is having low blood pressure, so definitely fluid. We selected it previously before. Now, patient is having infection. We always want to find out about the infection. So blood culture, definitely a thing we want to do. Right. Atrial blood gas, definitely a thing we want to do. So yes, this is the three things that is very important right now based on the patient situation. Now, atrial blood gas, remember, for atrial blood gas on the NCLEX, NCLEX can ask you what do you do prior to the procedure. Remember the Allen test. Don't forget that. All right, so the last part of the case study is what we call evaluation. Right, so let's go straight to evaluation.
So what is the correct answer for this last one?
The correct answer, vancomycin.
Okay, what about the blood pressure that is low?
Okay. Answer the question now. Look at the question and tell me what order are you going to do. Consider for the NCLEX is testing you on the order. Right. So you need to understand why you are doing each of this order. This. So right now, is there anything in this question that is telling you to insert indwelling urinary catheter?
No,
All right. Is there anything in the question that is telling you to give vancomycin?
because he has an infection, yes.
Okay. Is there anything that is telling you to do CT scan of the chest?
No.
All right. We definitely know respiratory condition can lead to cardiovascular issue. But right now, as at 12 o'clock, the patient is not having any dysarrhythmia, any problem to the heart or something like that. Though the blood pressure is low, but that is not really a problem because they are not telling us anything about the heart or something like that. So not really important now. Now look at the next one, sodium chloride.
That would be to bring up the blood pressure.
Are you sure or no?
I'm sure to saline. If the blood
Uh,
pressure is low, you give fluid to bring it up.
okay, so great. That is your two answer. Now look at the last one, laboratory test, blood culture, CBC, atrial blood gas. Is this something you want to do priority?
No,
No. Why?
because the last the information gotten by 12 noon didn't indicate any priority for that, for you to have a blood culture.
Why do we do blood culture?
To find out about the infection.
All right. So why are you giving vancomycin then? Why are you giving vancomycin?
For the infection.
All right. So why are you going to say we don't do blood culture then?
Mm. No, I'm not saying that we don't do blood culture. I said,
You are saying there's nothing on the nursing note 12 that is telling you to do blood culture. So I'm asking you why you not selecting vancomycin as your answer, because that same reason still apply. There's nothing in the 12 o'clock note that is telling you to also give vancomycin. But right now, actually, why are you giving vancomycin? You said infection. So where are you seeing the infection when you want to give vancomycin? And why are you saying no to blood culture when you are not seeing an infection? So there are two things that you are conflicting. One, look at your nursing note. There are problems that we have not solved already. The infection is still there. Nothing has been done about the infection. It's still there right from 10 o'clock notes. We've done nothing about it. So the infection is still there. 12 o'clock note did not tell us that infection there's no infection. It was an urgent call by the adult child. The adult child called the nurse instantly, and then the nurse had to do quick assessment. And on the quick assessment, that's what the nurse had right there, and she ran for help. That is it. So the information she just had is pulse, respiratory rate, blood pressure, and the oxygen. Right, the infection is still there. And then immediately, doctor put down all this order. 15 minutes later, from 12 o'clock, she did the assessment maybe for a few minutes. She ran to the doctor, and then 12:15, doctor gave the order that this is what you should do. Now, the NCLEX is now asking you, the nurse, which is priority for you to do. And we know we have infection previously before. So vancomycin, that is broad spectrum medication. You don't want to give vancomycin long time. I'm really going deep right now. Vancomycin, you don't want to give it for a long period of time. It's cause high risk for adverse effects. Vancomycin is just to fight infections that are very stubborn. So we don't really want to give it for a long time, most especially when we are giving it IV. Now, because it has adverse effect, Redman syndrome, ototoxicity, nephrotoxicity, yeah, all that kind of stuff. But broad spectrum, we give it because we don't know what infection the patient is having now. So we are just trying to give broad spectrum. Broad spectrum medication can solve any infection, right? But it's best we give the right medication to the right infection. Why? Because we are training the immune system to fight the infection alongside with the help of that medication. Unlike vancomycin that can fight the infection without the help of the immune system. That way, that infection can come back again, cause problem, right? Because our immune system like to fight a certain war and get prepared again if that situation occur again. I don't really want to go deep into that part. Now, so that's the main reason why we are doing blood culture. Because we want to see what infection so that we can know the right antibiotics to give. Right. And stop them from vancomycin. Complete blood count is to see if the patient is having increased WBC. That's the main reason why. The patient is having infection, all of a sudden blood pressure is low. What's going on? You can only just interpret what we call sepsis. Right, sepsis. I'm not seeing there's nothing in 10 o'clock note that's telling me why the patient blood pressure will be low, because the only thing I know is dehydration, bleeding. Patient is not bleeding, patient don't have dehydration. So what are we guessing? The next thing we are thinking is sepsis, septic shock. That's the only thing I'm thinking. So make more sense why I want to do blood culture. Make more sense why I want to check if the WBC is high from the CBC. Make more sense why I want to see if the atrial blood gas, because septic can cause what? Buildup of lactic acid. Am I right?
Yeah.
Right. That can cause, what are they calling it? Organ failure.
Failure mod.
So that is the main reason why I want to do what? Atrial blood gas.
So I have a question.
Ask me, please.
So for every infection, do you always do like a CNS?
Yes.
Okay.
Every infection. All right. So last part is your evaluation. Now, your evaluation part for each assessment finding, right, indicates the condition has improved, not improved, worsened. Right. So this is your what? Assessment finding. So we are comparing this assessment finding with this first. If we are not seeing our information here, that's when we can check this. We check recent before previous. Vancomycin, there's no infection right here, but guess what? If you check here, it's here. So vancomycin apply. Right. So that's how you go in your nursing note. You go from recent to old if you are not seeing the information. Now, the current assessment finding, the NCLEX say the patient is pale skin tone. So I'm going to check here. Now, I'm seeing pale, so not change. Respiratory rate 36, current finding. Previously, it was 32, so there's a +4 increase, worsen. Blood pressure 110 over 68. Previously, it was 90 over 60. So blood pressure is back to normal. Now, a lot of students, I always used to ask them, what's the normal range for blood pressure? They will say 120 over 80. This is not a range. Range is this 100 to 120 over 60 to 80. So this is the range. Systolic range, diastolic range. Anything less than 100 over 60 is hypotension. Anything higher than 120 over 80 is hypertension. This is not a range. This is just a value. All right. So now this fall within this range, which shows there's no problem with the patient. So improve. Now the oxygen 91 now, previously 91, so not change. Client is interacting with adult child. Previously is not acting right, but now they are interacting, improve. Any question? Any question?
No.
All right.
Understood.
So, okay, great. Right. So far so good. I've done the job for a lot of you. I have previously before I have gotten all the program you can think of. I've gotten Asha U-Word, Market, Limit. I don't just want to list. The best so far so good I've seen for practicing case study. I rate it 80%. All others, I rate it 10%. But the only one I can rate 80%, right? At least we still help you out. That is more aligned 80% to the NCLEX standard is bootcamp. I keep saying it all the whole time. That is only what I use bootcamp for. Case study. Right. That is what I can tell you for sure. If you are using other to prepare for case study, then you are giving yourself problem. I can guarantee you that. Right. So yes, there are a lot of information on bootcamp as well too that should not be added. But so far so good, I've checked every program case study. And the best is bootcamp. All right. So with that being said, I'm ending the Zoom.
Please, Favour, share that video, okay?
Sure.
Thank you.
You're
Thank you.
welcome.
Have a good night.
All right. Good night.
Good night.